Friends of Cal, you ready? Okay, Kevin's your class favorite, no matter what. You're the class favorite. Okay, we'll have California do our stroke. You guys had stroke, right?
Yeah.
Stroke recovery services. So this is a message that they're going to be able to use with pretty much family, case managers, physicians. Okay, ready? Here we go. Listen up, guys.
So for patients that have had a recent stroke, India offers a comprehensive range of physical therapy, occupational therapy, speech therapies that can benefit many patients, such as becoming more independent at home and in their community.
Very good. Now, the one thing, if you look over on the other side, if you look on page 49, see over there on the other side where it talks about the features, it has advanced on-site equipment technology, such as continuous passive motion machines, treadmills, stationary bikes, on and on. You see that right there? This is where we're talking about get in your facility, get to find out what a continuous passive motion machine is. Because remember, these features are going to be specialized to that patient's diagnosis, so you really got to get in and learn about these features if you expect that patient to benefit from them, right? Go in, learn about them, be able to speak to them when you're out there with the physicians, case managers. Because let me tell you, these doctors, they know these features. They're very familiar with them. What they want to know is how specific and how well do you know your features that you can convince me that my patient's going to what? Benefit from those features. Make sense? Very good. Okay, how about we go to Wonder Woman back here?
Okay. Kindred offers a special pulmonary program for patients with COPD, pneumonia, or respiratory infection requiring IV and other pulmonary diagnoses. Our care team provides individualized plans for the patient's specific needs. The goal is to transition the patient home with the resources they need to manage their pulmonary hygiene.
That's a whole plan of care that we just went through. They hit the diagnosis, they hit the features, and they actually developed almost like a discharge plan to present to this family. Did you guys hear that? Did you hear where we're going with that? So you're giving them the hope that they're leaving. Unless they're going to a nursing center and they're going to be a resident there, you want to learn how you can teach them what's the benefit, what's in it for me, the WIFA. Very, very good. Okay, lastly, our all-stars. Pulmonary, sorry about that, pulmonary. I won, I'm sorry.
Kindred, we offer specialty wound care services. We have a wound doctor that sees our patients on a daily basis, as well as, for example, wound care nursing staff. Comprehensive pain management, as well as all management, administration if necessary. Whether it's rectified, specialized dressing 3 times a day, or a wound vac maintenance, we got it covered.
Yeah, you know what? That's really good. Did you see how specific they got about the wound care? What are some of the descriptive words you used in there?
Like if it's just a dressing 3 times a day, at least for a major dressing or a wound vac.
Wound vacs. How many wound vacs do you guys see out there? Complex care, dressings 3 times a day. I mean, they see that you actually have studied their chart, because these patients know what's wrong with them. So do the families and the physicians and the case managers. They see that you've actually studied that chart. You know what's going on with them personally, and you know you're selling to them that Kindred can take care of that service that they need. So the more specific that you get, that's the takeaway I'm hoping you get from this. Know the diagnosis, study the chart. Read a little bit of the chart before you go to talk to anybody. Think of the features that you have that you're getting ready to go sell. Get in your buildings. Learn about these features. Learn the specifics surrounding these features. Be able to speak to it. The more you go into the buildings and study the building, the features, the more you can go ahead and sell that they're going to adjust, that they're going to benefit from those features. So you're going and studying the diagnosis, you're going to match the features to the diagnosis, and then you're going to study the features, getting it, that meaning you're going to go in your Kindred facility, you're going to go to the rehab clinics, you're going to learn the protocols, talk to your director of nursing, find out what services are specialized surrounding those different cardiac, wound, pulmonary, and stroke programs, so that you can teach the patients what the benefit can be. Because again, when it comes to the benefit, what's in it for me, you're going to have to describe a plan of care for them that's going to get them home. Okay? You guys feel good about this? I hear a couple people people made the comment, it's making sense, it's coming together. It takes a little bit of studying, that's pretty much it. So how about we come back about 4 o'clock, give you 10 minutes. We'll do some case studies, and then we'll wrap it up for you, okay? And thank you so much for working so hard on these, I appreciate it.
Bridget, can I just say one thing?
Go ahead.
Bridget's on. No, one of the things to your point you made earlier, it's great that we're working on the diagnosis and the feature and the benefit, but don't forget the other pieces that we've learned today with the question asking and the probing, so we're able to make it more of a dialogue. Because I think sometimes we get so bogged down and we've got so many features and we have so many benefits that it doesn't turn into a monologue.
That is a really good point. And I can tell you that's probably one of my biggest mistakes is not probing enough. Okay? Very good. Thanks so much, guys. Again, we'll do some case studies. That's